My first guest is Dr. Martin Favetto, who is an orthopedic surgeon, specializes in hand and upper extremity with Bluegrass Orthopedics. Welcome.
Well, thank you. Thank you for having me.
Well, now it's a pretty common injury to injure the hand, whether it be sports or falls. Where do you see it the most?
Well, it's the most common type of injury that I see. People are standing or walking or running and they trip and fall on their outstretched hand. That leads to quite a large number of fractures. The most common fracture is a fracture of the distal radius, the fractures of the end of the forearm.
Well,
we call those wrist fractures.
And there's different kinds of fractures.
That's correct.
Different treatments. Tell us about some.
Well, the most common injury is a sprain. That's just a bump on the wrist. And for most of those injuries, rest and ice and elevation is enough. But if there's a fracture, if the bone is broken, or if there's a severe ligament injury, in those cases you might need surgery or immobilization.
Well, tell me before you even talk about the treatment, how's the layperson supposed to know if they've got a wrist injury? Are there some signs or symptoms that say, hey, I need to see a doctor, or I need to go to the emergency room?
Well, usually there's a significant trauma to begin with. You fall and you land on the palm of your hand, usually, and that leads to a sharp feeling, sometimes a burning feeling in your wrist, and then there's swelling and tenderness to the touch.
Does motion have anything to do with it?
Well, sometimes because of the swelling, it's hard to move, or it hurts more if you try to move.
Okay, so you end up saying, I go see the doctor. What do you do?
Well, it depends. If your fingers are nice and pink, if you can move your hand well, and if raising it up above your heart level, not down here with a sling, but up above your heart, then, and your hand feels better, you could probably wait and call your family doctor in the morning. If your hand is very discolored or it's very tender and the pain just does not let up, then you need to go see emergent medical attention.
Okay, so they end up in your office, they end up with a fracture. Tell us about some and some treatments.
Well, the most common fracture of the forearm is the fracture of the radius, this bone right here. And the most common fracture in adults and in children is across the distal end of the radius. And many of those injuries, especially in children, can just be treated with a cast. In adults, many of those injuries do need surgery. The fractures of the smaller bones in the wrist are less common, but they're much more difficult to identify and treat. This little bone here, called the scaphoid, because it's shaped like a little boat, and scaphoid means boat-shaped in Greek, sometimes goes unnoticed on x-rays. So people come in, they have x-rays that show no fractures, and years later they develop severe arthritis from a broken bone. And those fractures can be easily picked up with an MRI scan.
So now, even if you see your doctor, you get an x-ray, the x-ray is clear, but you continue to have pain, that ought to be a warning sign you need to look again.
Absolutely. When we examine people with wrist injuries, we check different parts of the wrist. So if you have pain in this area of your wrist, right at the base of your thumb, that can be a sign of an injury to the scaphoid, and that's when we look for more imaging studies like an x-ray or an MRI.
And surgery sometimes require hardware.
It sometimes requires hardware. We do use plates and screws or pins. Now, a lot of times all you need is a cast.
Now, if you have a ligament injury, does an MRI help you more than an x-ray, or can you do it by exam?
Well, you can't really see ligaments on x-ray, so an MRI is crucial to determine if you have a ligament injury that is severe enough to need surgery.
And in the hand, there are a lot of nerves that can be pinched or irritated or injured.
Absolutely. Anytime there's swelling in the hand, you can compress the different nerves in the hand. You can have a compression of the median nerve, which gives feeling to the thumb, the middle finger, and the index finger, and a part of the ring finger, or the ulnar nerve, which is on the bottom of the hand, and it gives feeling to the small finger and a portion of the ring finger.
And you mentioned the median nerve. That's sometimes we see in carpal tunnel, and that's an easy fix for you as a surgeon sometimes.
Absolutely. Carpal tunnel syndrome is a very common problem. It's associated with a lot of common problems. It's associated with fractures, it's associated with diabetes, it's associated with obesity. So we see a lot of patients with carpal tunnel syndrome.
And you don't always have to operate on that, though.
Well, the best option, the option that gives the best success with the least amount of cost is surgery, but you can try therapy and injections to improve the symptoms enough to postpone surgery.
And if they don't get better, they come see you.
Absolutely.
All right. Great information. Thanks for coming in.